Well, welcome. Tonight we have a very interesting person to talk to, something that we don't quite think is available in Milford. You know, we're learning with everything that's been set up at the Regional Medical Center, the depth of expertise and the breadth of services. Tonight we're going to talk about a very special service, and one that most of us, frankly, don't really understand, that we have a preset conception of what the service is. And tonight we're going to learn a little bit more about why we would come visit. Why don't we start with an introduction?
My name is Dr. William Recupero. Sometimes I go by Bill. I'm not new to Massachusetts, but new to the Milford area. I just recently joined with Tri-County Medical Associates, and I operate out of Milford Regional Medical Center. I grew up in Stoughton, Massachusetts. I went to medical school in Kansas City, and I did a scholarship through the Army. And basically, working with the Army for the past 12 years, I was trained at Walter Reed Medical Center and the National Naval Medical Center in Washington, D.C., where I did a 5-year training program in otolaryngology, or ENT, commonly known as, and head and neck surgery.
But that's not your specialty right now.
That's part of my specialty, but that's not my subspecialty, if you will. So I have a formal background in that, and I'm also board certified in that, being ENT. I went on to do subspecialty training in just facial plastic and reconstructive surgery. And that was a 1-year intensive training on just the face, facial plastic, aesthetic, and reconstructive surgery. I did that through the Army with a civilian who's very well known in our field, is one of the founders of the Facial Plastics Academy of our country, by the name of Galen McCullough in Alabama. And from there, I went back into the Army to finish my active duty tour, and I just completed my service at Portsmouth Naval Medical Center in Portsmouth, Virginia, where I was the chief of their facial plastic surgery department. Having finished up my active duty service, I had the opportunity to come back home to Massachusetts, if you will. My family's from here. Most of my family's still here. And so Tri-County Medical Associates provided me the opportunity. And now I want to come here and really develop that uniqueness of my practice, which is the facial plastic and reconstructive surgery. Of course, I always have the background of the ENT. And I do practice some of that, but I would like to bring my subspecialty, if you will, to this area, to Milford Regional Medical Center, and to offer these services that ordinarily people may have to go to Boston or to Worcester to. And, you know, I don't know about you, but the traffic is terrible. So it doesn't, particularly in this area or in the Boston area. And so a lot of people don't know that you can have, or I provide those services that they may not have to go into Boston for, and it's convenient, and you don't need to be in there to do these things. So,
now, when most people think of plastic surgery, they think of improving or changing your facial appearance.
Right.
But that's not the bulk of the work you do, is it?
No, a lot of what I do is reconstructive, or sometimes we consider functional plastic or reconstructive surgery. That would include a large part of the rhinoplasty or nose surgery that I do. A good portion of it is functional, improving people's ability to breathe through their nose for structural reasons. And a lot of people don't really know or understand that a lot of problems with nasal breathing is not just congestion or allergies, it's functional problems with their nose. It oftentimes requires surgery to fix, and that's part of facial plastic and reconstructive surgery. That's the uniqueness that I can bring. Other things like eyelid surgery, for example. A lot of people can have problems with what we call their visual fields, because their upper eyelids are overhanging their eyes, if you will, and giving them problems with their field of vision. And that's something that is not necessarily cosmetic, but you can improve their functional ability to see field of vision-wise with a plastic surgery that I can provide. So there are, of course, some people who just want aesthetic changes, and that's fine. But a good portion of what I do is a mix of both reconstructive and aesthetic.
But now, let's start with something that we all heard of, a nose job.
Sure.
and you think of some vain young starlet who wants a perky, pointy nose, not a normal round nose. But when you talk about reconstructive surgery, that's far beyond vanity.
No,
Right.
what we're doing for reconstructive surgery in particular is we're trying to restore normal anatomy. And that may have been from a trauma in that person's past or recent future, from maybe a skin cancer they had on their nose. And we're really trying to restore normal. And to me, that's not being vain at all. You're just trying to make things right again.
But when I think of people who have breathing problems, and they snore terribly or whatever, it could be the passage that needs to be altered.
Exactly. And so a lot of times it's a very simple problem. Say their septum, the middle part of their nose on the inside, is deviated, and they're having problems maybe breathing out of one side or the other.
Sorry to interrupt. Deviated septum. Everybody hears it.
Sure. Crooked.
But crooked, okay.
It's pushed over to one side or the other. And that may have been a result of trauma in the past, sometimes even birth trauma. And patients don't even realize they could have breathed better through their nose for their whole lives. So some of the problems breathing through your nose is just a septum problem, but a lot of it isn't. It's more than that. It's the structural cartilage in their nose that's either deficient, misshapen, malformed, weakened from trauma, from just their own anatomy, maybe from previous surgery. A lot of what I do is fixing problems from other surgeries, if you will, revision surgeries. And so, that's something that, oh, go ahead.
I was going to say, now wait a minute though. I've got a deviated septum.
Sure.
The passage is crooked, whatever the reason. How do you go in and fix it? I mean, shades of somebody hitting my nose with a hammer to, what's the procedure? How do you do it?
A septal deviation is very, very simple, straightforward procedure for someone like myself or even a general ENT doctor. That's a straight-up airway procedure. We're not looking to change cosmesis or anything like that. It's done through a small incision on the inside of the nose that you can't see. Basically, the septum is largely cartilage. Towards the back of the nose, it becomes somewhat bony. And through that small incision, we're able to look at the cartilage of the septum, adjust it, move it over into the middle, sometimes take out small portions of the cartilage, and basically make it so it's in a midline structure.
How do you move cartilage?
Well,
I mean, to me,
without
it
being
feels
too
like
technical.
bone.
Cartilage is very pliable, so you can manipulate it actually more than you think. In a lot of the functional rhinoplasty work I do, I actually borrow cartilage from the septum of the patient to place in precise areas in other parts of the nose to support those areas for structural breathing. And so, during a septoplasty, it's all about exposing the cartilage and manipulating it so you can basically put it in the middle and improve the airway that way.
And then I get a straight airway and I can improve my
Correct.
ability to breathe properly.
Very straightforward, very simple procedure. Takes about an hour. It's outpatient surgery.
An hour?
Takes about an hour. It's outpatient surgery, and the recovery time is relatively short. It's about a week of mostly congestion. Now, that type of surgery doesn't alter appearance, so a lot of people are misunderstood that they think their nose is going to be broken, or they're going to get black and blue, or they're going to be
you see on
swollen.
TV with the big black eyes and...
That's a completely different procedure. Now, that's a rhinoplasty procedure in which sometimes you do get some bruising underneath the eye, and there's some manipulation of the nasal bones. And a lot of times it involves straightening the septum as well. So what we call that is called a septorhinoplasty. It's a combination of the two. Nose job, if you will.
But the nose job, no, that's cosmetic when you think of...
Sometimes it is and sometimes it isn't. For example, trauma. If somebody was in a car accident and they broke their nose, and a few months later they may come in to see me and their nose is crooked, and it wasn't crooked before. And so we can put that back basically in place and make it look like it used to be. And that's a rhinoplasty. But we're not trying to alter necessarily that person's cosmetic appearance, but we're just trying to restore normal anatomy. So that's what I would consider a classic, functional or reconstructive rhinoplasty.
Now, insurance covers many of these procedures. If I want a point to the left nose, that's elective.
Correct. Yeah.
So that's on me.
Correct.
But if I get into a car accident or something happens, I was born with a defect.
Sure.
Will the insurance cover that?
Many times they will. If we're trying to improve function versus just cosmesis, a lot of times insurance will cover that, and patients many times don't really even know that, and so they're reluctant to come in for a consultation or to even explore that option. And so if somebody comes in, like you said, and they just want their tip to be more narrow, or they just want the hump of their nose to be taken off, well, that's probably not going to be covered by insurance. But in many of the nose surgeries I do, it's a combination of the two. There may be some aspect of just cosmesis and some aspect of functional. And in those cases, insurance will cover part of the procedure and the patient may have to cover the rest. So that's a very common scenario that I run into a lot.
But that's something then, if I'm having problems breathing, I don't have to be totally fearful that I'm going to have to bear the whole cost.
No, and you always will know up front what the cost is going to be. I mean, one thing that we don't do is hide any fees or surprise people with large bills that they weren't aware of. So if there is a cosmetic only a part of the procedure, they'll know that up front. They'll know what the cost is. They'll know everything that they're responsible for, and so they'll know what they're getting into. Same thing with the insurance reimbursement. What we do with insurance companies is we get pre-authorization from them before the procedure is scheduled to know exactly what they're going to cover and what they're not going to cover. And that's important. That's the right thing to do for the patient, and really that's the right way to practice medicine. I mean, we're not in the business of surprising people with bills when they didn't know about it.
Well, no, not especially here at the Milford Medical Center, where it's such a small community. You could get away with that maybe once. I don't know that Uncle Phil would be real happy.
Probably not.
If he found out that people were playing around with the patients.
My job is to make people happy. I mean, that's really what the satisfaction I get out of it, so I'm not in the business of
Now,
that.
you had to do not just an ENT specialty. I mean, I'm always amazed at people that go into medicine because, you've got your undergrad, you got your med school, then your residence, you got all the pieces, and then even a subspecialty.
Correct.
It seems like when I thought of a plastic surgeon, I never knew they specialized.
They do when it comes to facial plastic surgery. Now, there are general plastic surgeons who go down a different track. I chose to do ENT first, and then from there developed kind of a real passion and wanted to focus my career more on the just facial plastics, which is a subset of ENT, if you will, a very specialized subset. A lot of that came from being in the military, working with a lot of war trauma. I was deployed in Iraq, and we took care of a lot of injured soldiers and did a lot of facial reconstruction, a lot of good work that I helped out with. And
you must get decades of experience when you're in a zone like that compared to a local hospital.
Absolutely. You get experience that you're not going to get anywhere else because you're not going to see anything like that in the normal day-to-day routine, if you will. And from that, I think you learn to develop specialized skills, and there's a lot of improvisation, if you will. You have to kind of think on your feet sometimes. And I think some of the best kind of breakthroughs in medicine came from war. You never think of war as a good thing, but in many ways, and I'm not just talking about facial plastic surgery, I'm talking about medicine in general. A lot of the things that we do in trauma centers today came out of war. And so, if there was a benefit for myself, I mean, that's one of the things, the experience, and just, it's not something I can ever, describe to anybody unless you're actually doing it.
No, I can't imagine. I mean, when I went to Baghdad, it was to go to the Baghdad Fair. And we stayed at the Sheraton or the old Baghdad Hotel. And our biggest worry was what we were having for dinner, listening to the people who went over during Gulf Storm and after. My hat is tipped to people like you that went there, because the trauma you must have gone through. I mean, how many patients did you see in a normal day there?
It varied. My time was towards the tail end of the Iraq War, so I would say things were probably slower than in previous years. But you'd find that things would come in waves where you would be, fairly slow and not doing too much for maybe a week at a time, and then be busy for 2 weeks straight. So I guess that's kind of maybe how war is. I mean, look, I was, compared to what the real soldiers had to do, if you will, my job was a cakewalk. I mean, I was in a sheltered environment. I didn't have to really go outside the wire. I felt fairly safe the whole time, and I could just focus on my job. Now, the real soldiers and Marines and airmen and everyone else who were really out there doing the tough work, I mean, that by far, that was much more stressful in my mind than what I had to do.
I'm amazed, because I remember we were over in Kuwait and we were heading to Baghdad. It was right in the middle of the Iran-Iraq war. And my darling bride was a little nervous about going to Baghdad. And I started laughing because I pointed and she said, "What's that?" I said, "That's Basra, right there." Baghdad's 45 miles from the front.
Yeah.
And really hit you that, yes, you can be humble and say you weren't in a direct line of fire, but I got nervous when I realized I was 12 miles away from the fighting. That was a scary movie. And for you to live there, I mean, I went for a week and I stayed in a nice hotel. For you to have to live there and then take care of the poor soldiers who were facing trauma, defending us, amazing. So now, is the rhinoplasty or the constructive surgery on the nose the thing that keeps you the busiest, or?
I would say probably it's the majority of my practice is, or a large part of that is rhinoplasty work, for sure.
But now you mentioned something I never even thought of. Eyebrows.
Sure.
Or eyelids.
Eyelids.
Eyelids. Okay, help me understand. Is it birth, or how do I hurt an eyelid?
Well, I mean, if you're going to talk about reconstructive surgery for eyelids, some of that may be, say, a skin cancer or an accident, and that reconstructing that from that standpoint. But I would consider probably what I was talking about earlier was a functional eyelid surgery, where you're taking away a lot of the heavy skin that's kind of obscuring your field of vision, if you will. And that's something that's very common out there to see.
So it looks like a droopy eyelid?
Correct.
Is that what?
Well, that's different. That's called eyelid ptosis. Ptosis just means it's drooping too low. And that's a different surgery from what we call blepharoplasty, or eyelid tuck-up surgery, if you will, where that's pretty much a removal of extra skin. So as we get older, and some people happens in younger patients than older patients, depending on that person, the lid of the upper eyelid gets thin, the skin of the upper eyelid gets thin, and it can get really redundant and droopy. And as it does, it can really obscure your field of vision. And a lot of people aren't even aware that they could see better if they had that.
So almost like a
addressed.
permanent squint?
Correct. Or a lot of times you'll see them with patients with headaches, because they're constantly trying to raise their eyebrows.
Oh, you're constantly trying
to see better, and they're subconsciously doing this. Correct. From that, they can develop what we, more or less a cramp of the muscles that are raising your brow, and from there you get a headache. And we'll see people who have that, and they didn't realize their problem is really their eyelids. And that's something that insurance will cover. You can get a very simple test by your eye doctor that will test your field of vision, and if you qualify, they'll cover that surgery.
Okay, I got to ask you, if I have extra skin, how do you get rid of it?
It's cut out surgically. It's removed.
So you literally taking out and then suturing?
Sure. I mean, it's a little bit more involved in that, but it's a pretty straightforward procedure for the most part. For the upper eyelid. The lower eyelid is a different procedure altogether. But for the upper eyelid, most Caucasians have a natural lid crease that's kind of hidden and you don't see it when your eyes are open. And that's where the incision is made, and that's where the incision sits. And then the extra skin gets very carefully measured out and trimmed away. And the incision, if you will, is now the crease. It's where it was. So really we utilize the natural crease that's already there to make the incision. So any sort of scarring is virtually imperceptible.
Now you're making me feel more and more comfortable about going to a face specialist, because, I mean, that's something that you don't get 2 shots at.
No, I mean, you have to be very precise. You have to know your anatomy. If you take too much skin, that could be a problem. So it's something that, it's the reason why I did a fellowship, to have the experience to offer these to patients. When I came out of my ear, nose, and throat residency, sure, I knew how to do an upper lid blepharoplasty, but I didn't feel like I should be offering that to patients without that experience, and more importantly, the board certification behind that. I mean, you can go to a lot of doctors who will take away your eyelid skin, if you will, or do an upper lid blepharoplasty.
Seriously?
Sure. So a lot of physicians out there will offer that, surgeons, if you will. But my whole point is that that's all I do. The face, I focus on the face. That's where my training is, and that's really, where my passion is. And so I would argue that I'm perhaps more qualified, if you will, to do those procedures.
Well, especially when it comes down to, if I dare say, microsurgery like you're talking about, I'm not quite sure I want to trust somebody who does it once in a while.
Right, and a perfect example of that is, you mentioned earlier eyelid ptosis. That's different than extra skin or redundant skin on the upper eyelid. Eyelid ptosis is your upper lid is actually too low on your globe or on your pupil. It sits too low. That's a different procedure to correct that. It's not just removal of skin. You have to manipulate the muscles underneath the skin. And I'll be honest with you, that's a very specific surgery that is very, of course I know how to do it, and I can do it, but I don't offer those services because it's not the type of surgery, in my opinion, you should just be doing every once in a while. The really good ptosis surgeons do it all the time. Because if you don't do it correctly, then somebody could be left with an eyelid that looks different than the other, and that's very obvious to pick up on somebody's face. And so, in many ways, I'm very comfortable doing all the procedures you talked about, but in some instances, I know my limitations, and I'm more than happy to refer those patients to a colleague of mine who maybe does them more often, like a ptosis repair or something like that.
But again, now it's a subspecialty of a subspecialty.
Sure. But that's the way medicine is now, and that's the way patients, in my opinion, get the best care.
Now, you mentioned bottom eyelid.
Sure.
Okay, that sounds counterintuitive.
Lower eyelid.
Lower. If I have too much, wouldn't it just gravity keep it down?
It can, in some cases, pull your lid down, and that is a reconstructive procedure to tack the lid up, and you'll see that sometimes in older patients. They lose their lid support. But most of the time, when it comes to lower eyelid, it's not just extra skin, it's the bags that people will come in and complain of. They have lower eyelid bags, if you will, that makes their eyes look tired.
Is there any physiological issues, except that I look like an old man, if I have bags under my eyes?
It can, in extreme cases, obscure your vision, yes, if you have really
Big enough bags?
Yes, and that's pretty rare. But I have dealt with patients like that, and insurance companies will often cover that procedure. But the bags, most likely, people come in and their biggest complaint is their eyes look tired, and they don't feel tired. And people are always saying, "Why are you tired? Did you get any sleep last night? Are you rested, or what's going on?" So to address that is a little bit more than just extra skin. There may be some extra skin involved there, and that can be excised. But there's fat behind the globe or behind the eyelid that, as we age, there's a membrane that holds that fat back. As we age, that membrane gets weak and that fat starts to show through as bags. And so for the lower eyelid, a lot of times we're addressing the fat that's showing through that's causing the bags, and maybe a little extra skin.
So it's actually a bulge almost.
Exactly.
So how do you get rid of do you just pull the fat out, or?
In some cases, you take out a little bit. In other cases, we reposition the fat. We put it in a different area, and rather than hollowing out the eye, it's filling out areas that need it. So, and that can be done through a variety of different approaches. Oftentimes, we don't even have to make an incision outside the eyelid. It can be made inside the eyelid, so you don't even see an incision for that. And so
Inside the
correct.
eyelid?
So underneath the eyelid, we can make a small incision, get easy access to the fat of the eyelid, either reposition it, maybe take out a little bit, cauterize or melt a little bit away, if you will, and then you're not left with any external scar, but at the same time, you're addressing the issue.
Wow. So anything left on eyes we haven't talked about?
The other part about the eyes that's important to note is the brow, okay? Brow is separate than the eyelid. Your brow is a whole different anatomic portion, if you will. And in some cases, people feel like their eyelids are too droopy, and that may be true, but also it may be that their brows have dropped over time. And if that's the case, a lot of times we do what's called a brow lift, or we lift the brow and reposition it in a more normal anatomic position.
How do you, pardon the ignorance, how do you lift a brow? Oh my God.
There's different approaches to that too. And normally when we're talking about facial plastic surgery, we try and hide incisions and make them look imperceptible. So most of the time when we're trying to address the brow, we do it from up high in the hairline or behind the hairline. And from that, we can actually come underneath, down onto the brow, underneath the forehead tissues, and release the brow from its attachments and reposition.
So you're going to go under the skin and do the work.
Correct. Through small incisions up behind your hair. And we don't shave.
Well, I don't have any hair, so you'd have a hard time.
But those incisions are well hidden. And we don't shave any hair. Okay, people are always concerned, you're going to shave my hair, might have a bald spot or something like that. No, I don't shave hair. I never shave hair. Because that's why would you want to have a surgery where you have to deal with hair that's going to grow back over the next 3 months? And so we can do what's called an endoscopic brow lift, which is make small incisions just behind the hairline. And even if you have a receding hairline, you can still do that with well-hidden
But what are you
incisions.
doing? You're pulling the skin up? Are you removing skin?
In some cases, you're removing skin, but in most cases, you're just repositioning the brow higher back to where it used to be and allowing more of an open eye appearance. And that can be a functional thing too. A lot of times insurance companies will cover that if I document correctly that it's not just their upper eyelid skin that's the problem with their field of vision, if you will. It's their eyelid skin and their brow skin, or their brows. And so that's the kind of thing that I try to educate patients on when they come in for consultation. Be like, look, you could have the upper lid skin removed, but that's not going to correct your problem. You need to have your brows repositioned as well in order to fully correct your problem. And from there, patients can kind of understand what the deal is and what their problem is and get the right procedure if they're going to go with that.
So that's bags and brows.
Right.
You hear this term crow's feet.
Sure. Crow's feet is the term for the wrinkles that occur on the outside part of your eye. Smile lines, if you will, is another term. And really all the crow's feet are the muscle that surrounds the eye in a circle. As it contracts in the outer part of the eye, it contracts in an up and down or vertical direction. That muscle is attached to the skin on top of it. And so as that muscle contracts when you smile or you animate your face, it will cause a crease to form in the skin. And when we're young, that's not something that's obvious. The skin is very
Pliable and compliant.
Exactly, and it's thicker, and it's not something that really shows through. But as we get older, the skin thins out, and those wrinkles start to show through. And sometimes they're called what we call static wrinkles, which means they happen when you're not moving your face. And at other times, they're dynamic wrinkles. When you smile, you see these crow's feet. And so there's different ways to address that, but the most popular way to address that is with something called Botox, which I think most people have heard of.
Yeah, I'm still trying to deal with botulinum toxin
Right.
being injected voluntarily into my body.
It is a toxin, okay?
I mean,
But
yes, it's been
not.
denatured. I hear you, but
It's a purified form of the toxin that there is really no risk that you're going to get, sick from that or tetany.
But now, what is Botox? I mean, God bless Allergan, all the people who did it, but
Right.
what does it actually do? Because most people don't understand what it does.
Sure. Botox is what we call a neuromodulator, okay? It's a fancy word for a muscle paralyzer, okay? And so what it does is it acts on a molecular level to block the chemical signals from the little nerve fibers to whatever muscle you inject it in from sending the right chemical signals so that muscle will contract. And so when you specifically inject it into a muscle, you temporarily, because Botox is not a permanent thing, lasts for maybe 4 to 6 months, depending on where you inject it. You temporarily paralyze that muscle. And when we're talking about wrinkles, we're trying to target specific muscles that when they contract, create those wrinkles. And so by paralyzing those specific muscles in those specific areas with a very small amount of the Botox, you're able to prevent those wrinkles. Now, you got to know what you're doing. If you inject it in the wrong muscle, too much, in the wrong area, then you can cause, problems that you can last for a while, 4 to 6 months in some cases. Usually not that long, but so it's a neuromodulator. It's great for dynamic wrinkles. Excuse me. So somebody comes in with static wrinkles, meaning that they have wrinkles on their face that
They're not moving, they're just there.
right. Botox is not going to help much with that. It may help a little bit because there's some involuntary muscle contraction that it will help with. But in those cases, sometimes we'll offer fillers, okay? That's a whole different topic, which is basically, and there's a variety of different fillers, but they're injectable materials where you physically fill the wrinkle. And there's a whole laundry list of different ones out there.
I remember Joan Rivers saying she had some material taken from her bum, put in her face, so every time you greeted her, you kissed her.
That's fat, and sometimes we take somebody's own fat and transfer it up into their face to fill out areas, and that's a very popular thing to do now, and it works great. It's your own body material. You don't have to worry about a foreign substance, and
There's no immunological response you have to
correct.
deal
You don't
with.
have to deal with rejection or something like that.
I don't know.
The key is natural appearance, and you don't want to overfill areas and make somebody look like
I look at some of the people,
Sure.
and we'll talk about facelifts or whatever, but it looks like their face has been pulled so far back that how they think they look natural just stuns me.
Right.
Really, I hate to say it, does look like plastic.
Right, and that's a telltale sign of plastic surgery and a stigma of plastic surgery that unfortunately is still out there. But from my training and my experience, and when patients come in for consultation, I'll tell them, look, I'm not here to remove every last little wrinkle in your face and make your face look like you were 20 years old. That's not natural for a 50, 60-year-old person to have a 20-year-old face. It just doesn't fit. And that's when you get that plastic look. But really what I focus on and what my goal is and what I educate patients on is like, look, we're looking to just give you a refreshed look, make it look like you're well-rested. And so somebody looks at you and says, boy, you look good. Did you lose weight? Are you doing something different? Did you change your hair? They can't really pinpoint what exactly was done to them.
Well, then you've gone through a good
Right.
surgery.
And that's the goal behind every patient that I approach. And so, sure, you'll find patients out there who have had that windblown look, that overdone look. In my opinion, it's not a natural look, it's not a good look, and it's not part of the way I practice. But, people will pay for
But
it,
now
they'll
we've
get it
seen it
done.
on Discovery Channel where they show them cutting and pulling skin back almost over their ears.
Right.
I mean, it's frightening.
It's not as, well, it's all relative, but it's not as bad as it's not as bad as what it may seem. And actually, it's a very straightforward, it's not a simple procedure, but something that is not, is a misconception. It's going to be painful. It's, we're pulling your skin or anything like that. When I'm doing a facelift, when we're doing a facelift as a facial plastic surgeon, we're actually not tightening the skin really at all. What we're doing is underneath the skin, repositioning the deeper tissues that have fallen, that have dropped, that have sagged over time. And by repositioning those, the skin that gets redraped is naturally going to have excess and be trimmed off, because the skin is intimately related to the deeper tissues in the face. So when you're doing a facelift, when I'm doing a facelift, I don't call it a skin tightening procedure, because that's not what it is. It's a tissue repositioning procedure. Some excess skin does come off because it has to.
But when you say some, a centimeter?
It depends on the patient. I mean, and that's the thing about facelifts in general. One size doesn't fit all. You may get a person who's in their 50s and 60s and may have completely different issues than somebody who comes in their 40s maybe, and just needs a little bit of a tuck-up procedure or a slight little tightening procedure, versus somebody who's in advanced aging that needs a lot more work, a lot more tightening. They're going to have a lot more extra skin. They're going to have a lot more different aging issues to deal with. It's going to be a much more involved procedure. And so that comes to the question, when's the right time to get facial plastic surgery if you're talking about aesthetics in general? And the answer is, there's not necessarily a right time.
Well, I would think the right time is when the patient...
Exactly. And some people come in and they're younger and they just have early signs of aging. And they just want to continue to look good. And so they don't need a procedure that's very involved. It can be a minimal procedure in some cases with minimal recovery. And there's not a drastic change, but at the same point, there's nothing to change drastic. And so they just continue to look younger than their chronologic age.
Now, just help, again, to a layman, when you pull skin back, how does it retain, the contours? And I guess I never understood it. I sit there and say, okay, the skin is attached all along.
Sure.
How do you pull some back and stay still? I want the dimple and the...
Again, it's not a skin tightening procedure.
Okay.
It's a deep tissue repositioning. And by repositioning the deeper tissues back into their otherwise younger placement, if you will.
So when they went south, you're moving them back up
Right.
north where they were.
And the skin is intimately involved in that. So by improving those tissues, you're also improving the overlying skin, or at least the deeper creases and the sags and bulges, if you will. Now, if you want to talk about the fine wrinkles of somebody's face or the skin pigmentation or changes from that standpoint, that's a different procedure altogether. That's just a skin-only resurfacing procedure, if you will. And a lot of times we'll combine resurfacing procedures with lifting procedures, or you'll have a lifting procedure, somebody will have a lifting procedure, and then come back 6 to 9 months later and get a skin resurfacing or rejuvenation procedure.
Okay, you got to help me with this, because resurfacing is Scott Christofoli when he resurfaces our roads. That I can understand. He cuts off an inch, puts a new...
In many ways, skin resurfacing is like that, and sometimes I try to compare, average everyday things like that to patients so they can understand. The skin is a complex system of layers, and we can resurface or rejuvenate those layers of skin with a variety of different mechanisms to give somebody a better skin appearance, to help with fine wrinkles, to help with uniform color and pigmentation. As we get older, as you've been out in the sun enough, your skin develops brown spots, pigmentation changes, it wrinkles very easily, it gets thin, and those are all surface superficial changes. So skin resurfacing improves that, and that involves everything from chemical peels to lasers to dermabrasion. And I've practiced a variety of the
chemical
field.
peels.
Correct.
help me understand what a chemical peel is.
A chemical peel is just a chemical way to resurface the skin. So what we're doing with specific chemicals, not average everyday chemicals, but these are things.
No, you're not taking nitric acid and just
No.
kind of put it in.
These are things that have been used for decades, and they penetrate the skin to a certain depth, depending on what.
So you go down a couple layers, or?
Correct. And from that, you're removing a couple layers of skin, and you can go from a superficial to a medium to a deep peel. The deeper the peel, the more changes you may have, the more difference you'll see, but also the longer it may take to heal. So as long as you don't penetrate beyond a certain depth in the skin, and we know that depth, what that is, then the skin will rejuvenate itself. And so it's a matter of using chemicals in this case to penetrate to a certain depth of skin to remove the age-related changes within those layers.
So
and develop
if
a new
you've got
layer.
like 7 layers of skin, you're saying that the brown spots, the liver spots, whatever they call them,
Right.
is only in the top layers?
Some of those are in the more superficial layers, and we can go down to those depths very easily and improve that. Now, when you're talking about like wrinkling of the skin, generally speaking, you need to go into the deeper layers to improve that, to help to build more collagen in the skin. Collagen is just the part that makes up the bulk of the skin. That by building up more collagen or rejuvenating collagen in the skin, you can help with wrinkles. And that's what a lot of the resurfacing procedures do.
So there I can see I'm doing my face with a chemical peel.
Sure.
Now, what's this shooting a laser at my face? That one this doesn't sound right.
Right. It's basically the same. When we're talking about different modalities for resurfacing, they all can get to the same endpoint, which is to resurface the skin or remove certain layers of the skin, depending on the depth of penetration. It's just a matter of which method you're going to use. And a laser is one of those methods. Lasers are just, light energy, basically. And we know through, decades of having lasers around that we can target certain tissues or compounds with a specific laser. One of the things we can target is water. A laser can be very specific to target water. Skin is largely water. And so a laser with the right energy can deliver heat, can deliver its energy to the skin and vaporize the water in that layer. Now, as long as you don't go too deep, you're not going to destroy the deeper layers of skin, and then you develop a whole new layer of skin. That's the premise behind laser resurfacing. We're targeting a specific compound, in this case water or element.
Now, this is all cosmetic, really.
In some cases it is, in some cases it isn't. I mean, there's a lot of parts that people don't realize are not considered cosmetic from insurance purposes anyways. For example, acne scars. Very common. It can be very disconcerting to patients. They can be very self-conscious about acne scars that they had, developed when they were younger, or teenagers or whatnot.
But isn't that mainly when you're a kid?
It can be, but adults can have acne just like kids. And so those pitting scars, those obvious scars that you'll see sometimes, they can be addressed with some resurfacing procedures. In many cases, you can use a laser. Or dermabrasion is something that I do a lot of with acne scarring.
Okay, so we figured out chemical, we figured out laser, now the sandpaper routine.
There you go, exactly. Dermabrasion is just it's a physical method of buffing down the layers of the skin. And we use special kind of, a special instrument with special burrs on it to basically burr off layer by layer of the skin, or sandpaper off, if you will, layer by layer of the skin to a depth, and you have to know which depth you need to go to. And by doing that, you can improve scars, you can improve skin, you can improve wrinkles, you can improve pigmentation. And it's just a different method of getting to the same endpoint. In this way, in that method, you're using mechanical energy or the dermabrader itself. It's not something that's practiced as much anymore because it's not taught as much in training programs anymore. Now, I was fortunate enough to train with somebody who has maintained that skill set And it's a very, it works great. It's a very kind of specialized approach to do it. And it works as good as a laser in many cases, as good as a chemical peel in many cases. And in some cases, it works even better, I think, than a laser or chemical peel, particularly for scars and that type of thing.
How long does it last?
The answer is, and the answer to all my patients...
Depends on the person?
In some cases, but procedures last forever, okay? But you can't stop the aging process. So I always tell patients, look, because they ask me, how long is this going to last? Or, you think of yourself on a conveyor belt of life, if you will, of aging. Well, I can maybe pick you up on that conveyor belt and pull you back. But the conveyor belt keeps moving. So you should always look better than if you did nothing. But we can't stop the aging process. We can slow it down and with people who stay healthy. And
if I did a chemical peel, here it is January.
Yeah.
When would you expect that if I want the same status point, is 6 months later, a year later, would I go back for another peel? Or?
It depends. If you're just talking about a superficial peel, you could maybe repeat that in a month. If you're talking about a medium or deep peel, you probably want to wait about 6 months or more before you want to repeat that. The skin takes time to heal. Now, does that mean you'll be walking around with obvious signs that you had a chemical peel for 6 months? No. I mean, the obvious kind of healing signs can be as quick as a couple of days to a couple of weeks, depending on the depth of peel. But the skin itself needs time to rejuvenate and time to heal beyond that initial obvious outward signs of healing. And you don't want to, do another procedure on it, before that happens. So you really need things need time to rest. And we know through, research and studies that the collagen within the skin continues to build over time. So I tell patients that, hey, look, you're going to notice improvement not just in the first couple of weeks. You're going to continue to notice improvement over the first few months, in some cases over a whole year. So you don't want to do anything until that time has passed, because you really don't know what kind of endpoint you're going to get to.
So, obvious question. I've done a peel, a laser, whatever to my face. How about the rest of me? Doesn't it look different that all of a sudden I've got this young, clean face and I got spots all over my arms? Or what do you do there?
I mean, I'm a facial plastic surgeon. I specialize in the face. And so, if somebody has other body issues, I'll often refer them to a colleague, maybe a dermatologist. Maybe it's just a skin issue and I need to send them to a dermatologist. Or maybe it's another body issue that they need to see a general plastic surgeon who does body work or that type of thing. And so I think a lot of what I do, and to get great results, and for people who end up getting great results, it's not just about the procedure that they had or what I did in the OR. That's part of it, but a lot of it is what they do to themselves and what they put in their bodies, how healthy they are. Did they drink a lot of water? Did they take vitamins? Did they exercise? Do they have a good weight? Do they have good eating habits? A lot of that, the people who do those things, who are healthy in general, they end up getting the best results. Because it's a whole, although maybe I'm focusing on the face myself, it's a whole body type of recovery and experience. And that's what I try to preach to my patients. That's what I learned in my fellowship. And we're not talking about just changing your face. We're talking about changing your life in many cases. And those patients who get good results, they're more confident. Those are the patients who walk around with a new life, a new livelihood, a new
just a little spring in their step.
Exactly. And it's more than kind of what I did. It's about what they're doing as well, and it's beyond the surgery itself. And that's part of educating patients,
Now, I got to ask you, why did you pick the face? I mean, of all places to specialize in, if you make a mistake on the breasts, the bum, 80% of it's still hidden.
Sure.
You can't hide anything that, on the face, you're looking at somebody, the first place you look is their face.
Right, exactly. For me, it's what really my passion is. It keeps my interest. It's a challenge every time, and it's something that for the reasons you just described, it's really kind of, I like a challenge. I like the fact that people are seeing my results. They can't hide them. You know, every face is different. No face is the same. Every face has different issues. And really, you know, that's
Yeah, I
really
mean,
what...
you can't hide. I mean, if you did less than an optimal job on somebody's
Sure.
breasts, well, wear a larger shirt. Or no crop tops if you didn't quite get their tummy right. Their eyes, I mean, you can't tell somebody to wear glasses for the rest
Right.
of the...
That's why I spent a third of my life getting to this point where I am now. I mean, it takes a lot of commitment, it takes a lot of time, it takes a lot of training. And it's not something that, you know, I would do or offer somebody without that training, without that experience. And so it's your face.
I mean, of
People
all
are
the
seeing it all the-
specialties, yeah, exactly.
Exactly.
There's the one that's on display.
And that's why I would argue, you know, as a facial plastic surgeon, we are really super specialized in just the face. And so we're asking people to trust your face to a facial plastic surgeon because we are the super specialists in the face. That's all we do. That's all we focus on. I'm not gonna do anything with your breasts. I'm sorry. I'm not gonna do anything with your
Bum
tummy.
or whatever, your
Exactly.
tummy.
So for me, that's just what my passion is. That's what I love to do. That's where it's my gratification. I can see the changes that I've done to patients, or you know, patients that get great results, the new spring in their step, the kind of the new look that they get, the new overall outcome that they
Yeah,
get.
people forget that sometimes cosmetic surgery has a huge psychological advantage. That if it makes you feel better, if it doesn't, it doesn't, but if it makes you feel better about yourself, that can just permeate everything you do.
Absolutely. There was a psychologist who did a very interesting study, who basically took a woman and create a fictitious resume for a job search, and took this woman and primped her up, got her looking good, gave her a complete makeover, attached that photo to the resume, and then sent it out to 50 different employers. And then with the other 50 resumes, they took her and they had her come right out of bed and basically show up and take their photo and put that to the resume. And now, how many people do you think responded back with the photo where she was made up versus the photo where she just came out of bed? I mean, it was overwhelmingly more for when she looked better. Now, that may not be politically correct, but in many ways, that's the way of the world. It's a very competitive world out there. People who look better, even if it's in their own mind, and that doesn't have to be an outward appearance.
And that doesn't have to be women
Exactly.
anymore, because when you think about it, if, you know, in my side of the world, in the sales, marketing type roles, if you feel better about yourself, and I don't know, you know, could be that, okay, I got a new pair of cufflinks with my daughters on. It just makes me feel better.
Right,
I'm going to portray that. I'm going to come across as more confident.
exactly. And that's exactly right. If you look better, you'll feel better. You'll be healthier in general. Those people who feel better about themselves, in general, are more healthy people. They practice more healthy habits. They eat better. They exercise. They keep their weight at an ideal level. It's all part of the persona, and that's why it's not just educating patients on, you know, your facelift or whatever. It's a whole body, a whole outward. It's a whole investment in yourself.
Well, that's why I always get a kick out of a lot of the weight loss. Take this with proper exercise,
Right.
you know, and diet alterations. Well, okay, wait a minute. It's kind of like whatever they gave you when you had a cold. You know, with 10 days of lots of liquids and chicken soup, you got better. Okay, it didn't matter whose chicken soup, it was that liquids and staying healthy. So I got to believe a lot of it is just the change that comes over in your mind, that now you exercise, now you stay away from that extra ice cream or whatever.
Yep, that's exactly right. And you think of patients who are battling other diseases, say cancer or something like that. those patients who have positive attitudes about their struggle with their disease, they do better. They have better outcomes. They beat their disease. Those patients who don't, they tend not to. And that's reflective upon, what I do as well.
Well, I hadn't thought about that because if I'm really fighting off a chronic illness, and every time I look at my nose or my skin, I see something that depresses me, that's going to have a very negative effect on my overall health compared to feeling better, looking up saying, hey, I feel good today.
Yeah, that's exactly right. And that's really where I get the satisfaction about what I do.
So now, how does somebody get to you? Do they need to go through their primary care physician? Or?
No. So currently I'm working at the Tri-County Ear, Nose, and Throat Surgery Clinic, which is right here in Milford. And you can call the clinic or come to the clinic, and some people just want to consult. They want to know what my opinion is and what they may have specific areas they want to address or specific concerns, and you can come in for a consult. Or you don't need a primary care referral. I mean, you can make a self-referral, if you will. And, it might be just sitting down and talking about, what your concerns are and what I could potentially offer. And a lot of the first time consultation is just educating the patient. Look, you don't, and sometimes it's just saying, you don't need anything. You know what? Surgery's not going to help you. As my job is not just to say, okay, let's sign you up for surgery. My job is to tell patients, in some cases, no, you don't need surgery. You just need to wait. There's not, no surgery is going to address that problem. And so sometimes that's hard because patients really, think that
they want instant gratification.
Right. And that's not the case. And I'm not doing my job. And in general, it's not good practice of medicine to do that. And so, yeah, I'm available for consultation. You can call the Tri-County ENT Clinic, and we can set up a consult. You don't need a referral, and kind of go from there.
Well, every time I look at Tri-County, every time I look at the Milford Regional Medical Center, I'm amazed, as I said, not only of the depth of expertise, but of the breadth of all the services offered here at the center of the universe. One more that I didn't know about that makes me even prouder that's been brought to the residents of Milford. So again, education is the key. If you have a question, and it doesn't have to be just for aesthetics, it can be functional, as we've talked about. Go down, get a consult, and learn. And then once you're educated, you can make an educated decision. So we thank you for joining us.
Thank you.
And as always, to our 6 loyal viewers, may God bless, and may tomorrow be a healthier night than tonight. Good night, all.
Not too long since I've been home.